Dr. Vivek Nangia. I am Director and Head for Pulmonology, Medical Critical Care and Sleep Medicine at Fortis Hospital, New Delhi. Unfortunately in India we don't have any such figures where you can say categorically that this is the number of people falling prey to pneumococcal disease. All one can say is that when you look at the various trends, there is a definite rise in the pneumococcal disease in our country. There are various studies which have been conducted which have been trying to identify that what are the causes of pneumonias, out of which it is seen that nearly amongst the various pneumonia patients getting admitted to a hospital, 40 to 60% of them are because of pneumococcal infection. There is always a rise in these kind of infections that we are seeing these days. Earlier it used to be confined only to the winters. Now we see that there is a rise in the summers as well. Change of season, summers, that is also a time when patients come to us with pneumonias and infections. So, pneumococcus is a bacteria which has a huge virulence. It can cause various syndromes, not just pneumonia, but it also causes an invasive pneumococcal disease, which could include something like infection of the brain, which is called meningitis. It could be just in the bloodstream, which is called bacteremia. So the mortality is higher when there is somebody suffering with a pneumococcal meningitis or a pneumococcal bacteremia as compared to pneumonia. The mortality ranges from anything between 10% and 30% in all these conditions. So pneumococcus is a bacteria which is colonized inside our upper airway. So nasopharyngeal area is where the pneumococcus bacteria even normally is present. Now it becomes invasive into some people. The issue is, why does it become invasive? It can become invasive if there is an underlying influenza infection. It could become invasive if there is an immunocompromised state, like patients suffering with AIDS, patients on chemotherapy, patients on steroids. There is a higher probability of it invading into people who are suffering with diseases like diabetes, heart disease, chronic lung diseases. And then in the extremes of ages, too young and too old. Those are the two brackets of age groups even in normal healthy individuals where there is an increase in the pneumococcal disease. Yeah, so it has definitely increased over the last 5 years, I would say. The number of COPDs have gone up, so proportionately the number of people suffering with COPD and its complications or a pneumococcal infection have gone up, definitely. Well, I think amongst the various preventable diseases that we have, pneumococcus is one disease which is actually preventable. There are so many infectious diseases all around us. Not all of them can be prevented. We don't have a vaccine for them. You would have heard of people struggling to get to a dengue vaccine, suffering with chikungunya. Unfortunately, we don't have. Malaria is another sphere where they're still exploring a possibility of a vaccine. And they're very close to it now. So, I think my perception is that whatever can be prevented should be prevented. Pneumococcal does have a vaccine, so why should we not use it? When it is being used world over, then why in India, where the burden is equally high, why should we not be using it? Yeah, so this is what is very unfortunate. The awareness levels are very poor, the education about vaccination is very poor, we are very familiar with the pediatric vaccination programs, the childhood immunization programs. The Government of India has also adapted a national immunization program which has been going on for years very successfully. But for adults, unfortunately, it doesn't seem to be our focus area, it doesn't seem to be our priority. I was just seeing a patient just about 10-15 minutes back who was a doctor himself, and I was asking him, he's been suffering with this chronic lung disease for last 10-12 years, and I was asking him that, have you been taking your vaccination? And his answer was, am I supposed to take one? He's a doctor himself. So when my next question was that, why should you not be taking? He said, I've been told by other doctors that when you're on steroids, you should not be taking the vaccination. On the contrary, anybody who has a chronic lung disease should be taking a vaccination. Anybody who's on steroids should actually be given a vaccination. So that is where the irony of the situation is, that even amongst the medical fraternity, the education about adult vaccination program is not as much. That is the most unfortunate part that we are suffering with. That our medical education does not include any chapter on adult vaccination. Now in the last 5-10 years, we see a lot of these books coming up, journals coming up which talk of adult vaccination. But unfortunately still there is a large medical community also which is ignorant about this. So I think that is what we are trying to do through your medium, to be able to create that awareness on all these preventable diseases. Whatever can be prevented should be prevented. So influenza, herpes zoster, pneumococcal, diphtheria, pertussis, these are the diseases, tetanus, these are the diseases which can be prevented. So the regimes are different but similar. I mean, the concept is similar. Basically, immunity gets compromised in all. So one in the extremes of ages, and then those who are suffering with diabetes, heart disease, liver disease, kidney disease, lung disease, AIDS, those who are undergoing chemotherapy, those who are on prolonged steroid therapy or any other immunosuppressive therapy, all those patients should get vaccination. Well, there is only, if we talk of only the pneumococcal vaccination, then it is to be given in 19 to 64 years of age group with any of these immunocompromising situations which I have just discussed, or plus of 65 years of age group without any coexisting disease also they could be given a vaccination. Question. The various studies have been conducted, not in India unfortunately, but abroad they've been conducted, and they've shown that the risk of a diabetic patient acquiring a pneumococcal infection is almost 3 times or 6 times higher than a normal individual. So also in COPD patients. In immunocompromised patients, it is almost 20 times higher, their risk of acquiring a pneumococcal infection. So the efficacy has been shown to vary from 57 to 87%, somewhere to that tune, which is a very good figure, I think. So if there is a 50% chance that you will be prevented from acquiring a pneumococcal infection, why should not you not be taking the vaccination? So as I said, the age group is different. I mean, in the young and the elders, and then those between 19 to 64 years of age group, depending on their existing illness, one would decide whether they need a vaccination or not. In near future, I think if we are able to spread the message across, first thing is to be educating the medical fraternity itself about our adult vaccination program, and second is to be educating the common public as well as the patients. So initially there always used to be a hesitation, when you would advise the patient the first time that he requires a vaccination. You would say, "Doc, why do I need it?" And everything is going on well. But now I've seen over the last few years, you give them the first shot of vaccination and they come back to you the next year saying that, "Oh, I need another of those shots." So that is a level of awareness because it does help them somewhere. As compared to previous years, the acceptance rate for a vaccination has really gone up even in the general public. You tell them that they need a vaccination and they get it done. 5 years back when you would tell them, they would usually evade your comment and would usually walk out of the OPD saying that, "Okay, we'll think of it next time," or "We will consider it," and never turn back again. But now the awareness levels, education levels are increasing, and the acceptability is also on the rise. The problem there that comes is then about the costs. So as far as the pediatric vaccination program is concerned, the government of India has taken it up. The vaccines are cheap. There have been various subsidies that have been given to these vaccinations. But unfortunately, when it comes to adult vaccination program, that doesn't seem to be a priority for our country because it's a huge burden of the elder population. So there, when it comes to the cost of vaccination, that is significantly high, but definitely still manageable. So we all, at least we have our own vaccination program that is in place, where even patients who are coming in for their, I would not call them patients, but people who are coming in for their regular health checks, we are offering them a vaccination as per their age group, as per their disease status. And so definitely I agree that we need to have a program in place, a leaflet designed where you can offer it to them that, okay, these are the vaccinations that you should be taking at this interval, and it should definitely benefit them.